Toddlerhood ranges from the time children begin to walk independently until they walk and run with ease. The toddler's development of fine and gross motor skills supports the move toward independence. Children begin to demonstrate their independence. Their mobility and cognitive abilities are developing. When they get frustrated, the dreaded tantrums may occur. Physically, these children begin to feed, dress, and toilet themselves. They begin to develop fine motor skills as they scribble and draw. Mobility increases as they begin to run and jump and want to ride a tricycle, climb, and further explore. Cognitively, they are putting words together. They ask the favorite question, "Who's that? What's that?" They also are into "what's mine" and "me do it." Linguistically, they have a vocabulary of about 300 words by the time they are 2 years old. At 3 years old, they will put sentences together. Talking to toddlers helps their language development. Reading to them increases their vocabulary. Psychosocially, they have a sense of autonomy. Remember, this is according to Erickson. Toddlers are still attached to their parents and fear separation. Kids do not necessarily play with each other, but they play alongside each other. Parents need to provide toddlers with graded independence, allowing them to do things that do not result in harm to themselves or others. Health risks for this group are many. Toddlers who become ill and require hospitalization are most stressed by separation from their parents. Mealtime has psychosocial and physical significance. If the parents struggle to control toddlers' dietary intake, problem behaviors and conflicts can result. Toddlers want to put everything into their mouths as they continue to explore their environment. Finger foods will let them feed themselves and explore food groups. Increased locomotion skills, the ability to undress, and development of sphincter control allows toilet training if the toddler has developed the necessary language and cognitive abilities. So toddler range is between 1 to 3 years of age. During this period, growth slows considerably. Height and weight increase steadily in spurts at a slower rate than the infant. They generally reach about half adult height by age 2. Average weight gain is about 3 to 5 pounds per year, and their height increases in an average about 3 inches per year. Their fontanelles have closed by 18 months, and the head size is more proportional to body by age 3. Child's extremities grow faster than the trunk, resulting in a more proportionate appearance for the body as a whole. The typical 2-year-old has a pot-bellied appearance and lordosis. By the end of the 3rd year, the child is taller and more slender. The neurological system, the brain reaches about 90% of size by age 2. In the respiratory system, alveoli increase in number until age 7. The trachea and airways are small compared to the adult, so things like asthma can really affect a child. The cardiovascular system, the heart rate begins to decrease and blood pressure increases. For the gastrointestinal system, the stomach increases in size, the small intestine grows in length, and the stool passage decreases. The genitourinary system, bladder and kidney reach adult function by 16 to 24 months, and bladder capacity increases, but the urethra remains short. The musculoskeletal system, bone increases in length, muscles mature, the sway back and pot belly begin to disappear around age 3 years. The gross motor skills include running, climbing, jumping, pushing or pulling a toy, throwing a ball, and pedaling a tricycle. Fine motor skills progress from holding and pinching to the ability to manage utensils, hold a crayon, string beads, and use a computer. Emotional and social development of the child focuses on separation, seeing oneself as separate from the parent, individualization, forming a sense of self and learning to control one's environment leads to emotional lability, and egocentrism, focus on self. Being picky as a child, especially during eating, is called neophobia, and it's normal and adaptive with wide temperamental variations. They can eat everything or only like 3 foods. But on average, a food is offered 10 times before a child will accept it. But you must remember, children have a more acute sense of taste than adults and do not always want to eat what their parents or caregivers are eating. So that normal drop-off in growth in that second year of life and normal increase in exploration and development of both motor and speech skills and more sensitive taste buds and development of independence makes it difficult sometimes to feed the toddler. There are 10 red flags that may signal an early motor development problem, such as the child's motor skills are regressing, the child's limbs seem stiff, the child's muscles seem floppy or loose, the child doesn't walk past 18 months, the child is walking on their toes, the child favors one hand or side of the body over another, the child seems very clumsy, the child is constantly moving, the child has trouble grasping and manipulating objects, or the child drools and has difficulty eating. So if someone would notice those behaviors, or as a healthcare provider you would notice these behaviors, they would have to talk to the physician about further testing for these behaviors. Now, typical behaviors of the toddler, they may rely on a security item, like a security blanket, a stuffed animal. They become aware of their gender differences. They may even display aggressive behaviors. They show fear of loss of a parent and of strangers. They become more self-aware. They do not have clear boundaries, though. They may have separation anxiety. They may resist invasive procedures when you're caring for them. Now, toddlers and mealtime may be difficult. Mealtime should be pleasant. What is eaten is more important than how much is actually eating. A general serving size is about 1/4 to 1/3 of an adult portion, and they may have a hard time sitting through an entire meal. You may have to use finger foods. And common developmental concerns may be with toilet training, negativism, temper tantrums, thumb sucking, sibling rivalry, and aggression. Now, the child is ready to use the toilet when he or she stays dry for at least 2 hours at a time, or even after naps, recognizes that he or she is urinating or having a bowel movement. For example, the child might go into another room or under a table to have a bowel movement. Make sure that they have physical skills like the ability to walk, the ability to pull pants down. If they start copying a parent's behavior, they can follow simple instructions. So you have to watch for these signs to see if they are ready for toilet training. Now, thumb sucking is a common habit among children. At some point, you may want to try to get the child not to suck their thumb because it can cause some tooth problems. Now, remember, babies have a natural rooting and sucking reflex, so some thumb sucking can actually be a calming mechanism. So it's really not a concern until a child's permanent teeth come in. At this point, thumb sucking might begin to affect the roof of the mouth or the palate and how the teeth line up. So the American Academy of Pediatrics says treatment is usually limited to children who continue sucking the thumb after turning 5. So it may not be such a concern. If the parents do have a problem with it, they can use positive reinforcement, praise the child, or provide small rewards such as extra bedtime story or a trip to the park if he isn't sucking his thumb. But you want to identify triggers. If your child sucks the thumb in response to stress, so you can use other ways to help them deal with stress, such as a hug, reassuring words, give them a stuffed animal to squeeze, something like that.